In this video, I answer a question from a massage therapist on why I always treat nerve entrapments first before addressing the fascia and the muscles. For those of you who don't know me, my name is Dr. Matt Maggio, and I'm a non-surgical expert in chronic pain treatment. My focus is on finding and fixing nerves that become stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and reducing inflammation from chronic pain naturally without the use of medications or injections. This results in a significant increase in flexibility, function, and long lasting pain relief. I'm also the creator of the Peak Method, where we teach overworked massage therapists a new treatment system that cuts session times in half and eliminates the frustration of inconsistent results so they can avoid burnout and help more people get out of pain. All right, so the question this week came from a massage therapist. His name was William in Ohio. He's been practicing, he said, since 2015 and specializes in treating clients seeking relief from chronic pain. His question was, I noticed in your treatment process, you say that you always treat the nerve entrapments first before treating any other structures. Is that what you would consider a neuromuscular treatment method? What about restrictions in the fascia? Wouldn't you need to treat that first to get to the deeper nerve entrapments anyway? Plus, we are seeing more and more that many issues are rooted in the fascia and must be addressed as well. Thanks for the question, William. Let's get right into it. Just a quick reminder, I do love doing these types of videos. So if you have any questions you'd like me to answer, send them my way. And if I think I can help, I'll get a video out to you. The information to do that and submit your question is in our profile or wherever you might be consuming this video. So why the nerve entrapment? First, I would say there's a hierarchy in the body. I talk about this a lot in my trainings. There's 7 potential problems you can have when a musculoskeletal injury presents to your clinic. One can be a bone problem, cartilage, a disc, a ligament, a nerve, a soft tissue, or a tendon problem. Now, over the years, I was kind of treating nerve entrapments and soft tissue restrictions in the muscle, the fascia, the ligaments as well, along with the nerve entrapments. But what I found is that the body has a hierarchy, and essentially what it wants to do is if the nervous system is compromised, especially if like nerves are stuck somewhere, it's going to prioritize that above all. So a lot of times you'll see like postural distortions and things like that, where maybe the shoulders rolled forward or the glutes not firing and things like that, because there's an underlying nerve entrapment. So the body's number one thing is let's protect the nervous system, because if the nervous system doesn't work, then nothing else works. So it'll sacrifice a lot of other things like the bone, cartilage, disc, ligament, muscles, and tendons across the board. There's also this idea called protective tension. When a nerve is stuck and caught, the muscle engages in a protective type of tension to unload the area. I always say it's the kind of same thing as if like you sprain your ankle, your body knows to kind of limp on that to unload the area. This is what's happening a lot as well, where people say things like, like lower cross syndrome or upper cross syndrome, and like something's tight and engaging too much, you got to get it to relax. It's tight and engaging too much because the nerve is actually caught and getting stuck. Next thing is just this one structure fallacy. We're all guilty of this. I've done it as well. And what William said in the question too is like, well, what about the fascia? It seems like every couple of years there's a new thing that comes up, and it's like, you got to treat this, and that's the only thing you need to treat, and it'll be good. It'll be the fascia, or maybe in the shoulder, it's like just treat the subscap, or the low back, it might be like, let's just treat the psoas. It's a combination of everything. You have to kind of get all of the data, and thinking that you're just going to find this one magic thing and it's going to fix everything is actually counterproductive. And I think it's kind of lazy thinking as well. So why what I do isn't neuromuscular treatment. At the end of the day, I'm not a big fan of neuromuscular treatments. I've made videos about that um, over the years. I don't even consider it an effective treatment. I do think when they're doing some treatments for neuromuscular, they have it backwards. They think it's like a problem with the brain and how it's firing, but it's really more of like a peripheral nerve entrapment and things getting caught there. And a lot of times when they're doing these treatments, they're playing a trick on the nervous system and they temporarily feel better, but they actually didn't fix anything. So I think that's not an effective treatment, and it's dangerous. Next is we always want to go after like cause and effect, trying to figure out. I always say the effect is like the smoke, the cause is the fire. And a lot of times, if we're just solely focusing on where it hurts and where the symptoms are without taking a full history and getting all the data that we need, we're never going to really get to where we are. And a lot of treatments are really just focused on the effect and not the true cause. And then we always just want to answer why. We want to say, like, why is the muscle tight? Why is the muscle weak? Instead of just being like, oh, it's tight, let's stretch it. It's weak, let's strengthen it. We want to start thinking critically and being able to explain things as we go. And that's a lot of what I teach, is like teaching you to think more critically. And what I say, become a clinician first and a technician second. So, nerve entrapments, how do they form? So, over time, most of the time, when muscles and ligaments are overworked, overstressed, maybe with bad posture, not enough movement, sitting too long, maybe doing too much activity, to develop this stuff called adhesion, also known as scar tissue. It gets inside the muscle and gets builds up over there. And originally, what it does is it makes the muscle less flexible, and then it makes it weaker. But over time, that adhesion gets bigger and bigger, and then eventually it gets stuck to the nerve. Nerves are built with about 15% of extra slack to kind of make it from where they go. And what happens is eventually it gets stuck there, and then it's having to pull a lot. So a lot of times when I'm seeing like symptoms further down the chain, a lot of times I'm thinking something else is going on higher up. Next thing is they're not trigger points. A lot of people encounter these and think they're trigger points, but a nerve entrapment is actually a physical change in the tissue, where a trigger point actually isn't that at all. And a lot of those trigger points that you're feeling around the area is that, going back to that protective tension, where the nerve is getting compromised, is getting stuck. So the muscles around there are tightening up. So a lot of times when people treat a nerve entrapment, they treat it like it's a trigger point, and it's not an effective treatment. So treatment errors I do see when people find nerve entrapments, first is they're too compressive. So nerves are, like I say, like the Goldilocks of all the structures in the body. They want just the right amount of depth and just the right amount of tension. And a lot of times people are way too compressive. They might use their elbow. They might use too much pressure. It really needs proper depth and then proper tension. So when you're finding a nerve entrapment, first you got to find it first. It starts with a very thorough and detailed functional evaluation, detailed palpation, and understanding your anatomy and knowing where these nerve entrapments can occur. And once you do find it, you want to put the muscle in a shortened position that allows you to get some depth up against it into the nerve, and then you tension into the nerve, and then you have the client go through a full range of motion as that nerve and that muscle slides under your hand. That's what actually breaks it up. It doesn't need a ton of pressure, it doesn't need a lot of force, it just needs the right amount of depth and the right amount of tension. Then what I find with nerve entrapments, a lot of times, especially down the arm or down through the leg, into the foot and the ankle, a lot of times what I do is I like to start distal, like down that area, and work my way up the chain as we go, and then work more proximal, back to the source, which is the spine. On the neck, it's going to be like the nerve roots and the scalenes and the cervical plexus. And then down low in the lumbar spine, it's going to be the lumbar nerve roots, the lumbar plexus. So like kind of start distal and work your way up more proximal as you go. Next is just getting the treatment dosage right. Nerves are pretty sensitive. They're usually pretty beat up. There's usually a lot of inflammation and dysfunction in there. And a lot of times they don't need a lot of treatment. They just need a focused treatment. So I always say no more than like 3 to 5 treatment passes on a nerve entrapment area. Don't go in there and like overdo it, beat it up like crazy, use your elbow, just jam on it. It doesn't need that. It wants just the right amount of tension, and you want to get it just right. Then once I clean up the nerve entrapments, then I'll start to treat like the surrounding structures, like the fascia, the muscles, the ligaments, and everything like that. But what I found over the years was I was treating the fascia and the muscles and the ligaments, but I wasn't addressing the nerve entrapment, and then the problems kept coming back. That's where that protective tension goes. So once I treat the nerve entrapments, then I'll start to check the surrounding structures and see where they go. And a lot of times what I'm finding is I'm not having to treat those as much, because I free up the nerve entrapment, which restores flexibility, function, biomechanics back to the area. So I can actually do less treatment, but more effective. That's all I got in the video. If you want to, share any insights you may have gotten in the comment section below. I try my best to talk and engage with anyone that has some legitimate and real questions. Next, if you like what I'm doing and you like what I'm sharing, share it with other providers that you think it might help. I just want to get the word out there about doing better quality work and helping more people get out of pain. And lastly, if you really like what I'm doing, you can go download our free training modules, where we take you through the whole process from start to finish of figuring out a shoulder complex problem, what to do, how to palpate it, what tests to do, how to manage it, everything like that. All the information to do that is wherever you're consuming this video. I appreciate you watching the video, and I'll catch you on the next one. Bye.